right, we will go ahead and get started. We are recording, so those who are joining us a little bit late, if you miss any part of this, you are welcome to go back and watch any part that you missed. I just want to say thank you all for joining our panel tonight. We are very excited to have 6 very well experienced and equipped speakers who are joining us today to share their experiences, some as athletes, some as professionals. So we're very excited to have them here today. I want to go ahead and just introduce our panel. So we have, like I said, we have 6 different individuals. I'm actually going to just prompt them and they will go ahead and introduce themselves. So to start, I'm very excited to welcome and introduce Ryan O'Callahan. Ryan, if you want to go ahead and just say hi.
Hi, everyone. You want to give a brief intro?
Yeah, go ahead. Please share.
All right, so my name is Ryan O'Callahan. I'm from Northern California originally. I went to college at UC Berkeley, and then I went on to play professional football for 6 years for the Patriots and the Chiefs. After retirement, I came out as gay and wrote a memoir called My Life on the Line, which really talked about my whole life, including a lot of substance abuse issues, which is main reason I'm with you here today on this panel. I also run a charity to help provide support to LGBTQ athletes.
Thank you for being here, Ryan. We're so excited to learn more about your journey and your experience. Sterling?
Sure. Hi, everybody. Thanks for joining us tonight. Thanks for having me here. I'm Sterling Elliott. I'm a pharmacist in the city of Chicago at Northwestern Memorial Hospital. I'm also an assistant professor of orthopedic surgery at Northwestern University's Feinberg School of Medicine. And I have an area of expertise in helping people manage their pain after surgery, which becomes a very important thing because that's often an entry point for folks who end up developing some problems using controlled substances, things like opioids. And we teach people to understand the nature of their pain and to really, treat their pain and look for options to treat their pain based on how they're doing rather than how bad they think that pain feels. So I'm really excited to join everyone tonight and hope that I can share with you some ideas that may help you if you ever find yourself down the journey of having to deal with some pain that comes from playing sports.
Thank you, Sterling. Very excited to hear more about, like I said, your experience and hear more about what you're doing at Northwestern. So thank you for being here. Dr. Courtney Albinson?
Yes, thank you. Hi, everybody. I'm Dr. Courtney Albinson. I am a licensed psychologist, a clinical psychologist, and a sports psychologist, and I direct sports psychology services at Northwestern University. At Northwestern, we've got a team of sports psychology professionals, including other sports psychologists, postdoctoral fellow in sports psychology, a psychiatrist, a mental performance consultant, and a program assistant. So we have a really nice team over there at Northwestern, and we work really in an integrative way with our sports medicine partners. So a lot of the folks here that are on this panel today, athletic trainers, team physicians, dietitians, and so on, certainly our coaches and administrators and advisors. So really approach the work from a very collaborative and integrative way. Thank you for having me.
Thank you for being here. Bev?
Good evening. Yeah, my name is Bev, and I founded and run a local nonprofit charity called the R.E.A.L Foundation, and we do drug education, prevention work. I do Narcan training, opioid education, and I also have grief groups for those left behind, like myself, after losing a loved one from opioids. So thank you for having me on.
Absolutely. Thank you for being here.
Yeah.
Bailey?
Hi, everyone. I'm excited to be here. My name is Bailey Cullen, and I played soccer at the University of Notre Dame. During my time there, I was diagnosed with chronic exertional compartment syndrome. I had 4 surgeries, went down a long mental health journey, and I founded a podcast and social media platform called Stronger Scars, where I get to just talk and have other injured athletes on to share their stories. So thanks for having me.
Absolutely. Thanks for being here. And last but certainly not least, David?
Hi, everyone. Thanks for having me. It's great to be here. I don't have nearly as intriguing of a story as everyone else, but So my name is David. I am the head athletic trainer at Lake Forest Academy. It is a boarding school in the northern suburbs of Chicago, grades 9 through 12. I also help coach our girls basketball team, and I help out with our golf team as well. But like I said, I'm happy to be here to discuss kind of mental health, especially following the pandemic. I know it's an issue we've all struggled to tackle. But again, it's great to be here with all these great professionals and to hear from everyone.
Thank you for being here, David. And as I shared earlier, we all know, everyone on this call knows how important your role is. So thank you so much for being here. All right, so without further ado, we will go ahead and jump right into our panel discussion here today. Very excited for all of you to learn a little bit more about our panelists, as well as their experiences and their expertise. So thank you all again for being here today. So I'm going to start off with Dr. Courtney Albinson and ask you just to start, based on your experience, can you share with us the relationship between substance use and misuse and being a student athlete kind of at all levels?
Sure. So, when I was thinking about this question, thinking about what are some of the reasons why athletes might use substances. And some of those reasons might be some of the general reasons that any maybe adolescent or college age individual might use a substance. That could be things like social, celebrating with friends, some sort of enhancement, like feeling like it gives you a pleasant feeling, conformity, kind of that pressure to fit in, be a part of something in a group, or feeling pressure to consume a substance, and coping, things like coping with anxiety, coping with sleep concerns, or just trying to kind of not really think about problems or what's going on for you. So sometimes as an avoidance strategy. So those might be some things that kind of adolescents and young adults might experience, whether you're an athlete or not. And then as an athlete, there's some very unique experiences that you have that also can factor into, potentially using or misusing a substance. One could be kind of some sort of way of positive reinforcement. So let's say that, the team wins the big championship and they celebrate with alcohol. And so it becomes kind of part of that team culture, kind of a way to reinforce positive results on the field or court. Sometimes, things like being part of a team or a group and kind of feeling like that's a way to fit in with my teammates. And then some of it could be really sport specific coping. And I know we're going to dive into more of that today, but for example, managing pain, we've got folks on the panel here who will be talking quite a bit about whether it's opioid use or responding to injury. So certainly things like managing pain. Sometimes athletes might use or misuse substances to cope with poor performance on the field or the court. And, something in terms of a few different substances that, we tend to see and are kind of particularly attuned to, especially in a collegiate environment, would be stimulant use. So medications that are prescribed, say, for someone who has ADHD. Sometimes those are drugs that could be misused. So that folks who are really focused on maybe they believe like an academic advantage or an athletic advantage might take a prescription medication that doesn't belong to them or use it in a way that it's not intended to be used. Also marijuana, we're starting to see kind of more and more marijuana use, and that is kind of often being a way that athletes are self-medicating for anxiety or sleep concerns, so we're routinely assessing for that as well. So just wanted to call out and kind of highlight a couple of substances that, are particularly ones that we assess for and encounter in student athletes.
That's great. Thank you for sharing that. So Ryan, from your experience being a professional athlete, can you share with us, what the relationship potentially is between substance use and being an athlete more at, at a professional level?
Yeah, she touched on a lot of good points on reasons why people, actually start taking them. But I think a lot of us most of us are introduced to pain medications on a very innocent level. You actually have an injury and they give you a pill, but I don't think people realize how quickly that can turn into an addiction. In college, I vividly remember on the aircraft flying home from an away game, the team trainers or doctors would literally go around with exam gloves with Vicodin in them and just hand them to people. And I think that kind of created this kind of loose idea that, okay, just take it, whether you're in a lot of pain or not. But, obviously I did have other injuries, but I think to me in my mind, it just created this kind of loose idea that these pills are okay. Now that was 22 years ago. And I think a lot of people have a better understanding now, but so yeah, I think it's very innocent going into it, but you quickly get addicted. And the reasons why I took pills longer than I should have were to cope and to hide, the feelings I had inside that, made me feel small and not worthy. And, I people who are a bit naive to painkillers don't realize that, you could take one pill for a week, but then by the end of the week, you really need 2 or 3. And Sterling and I have chatted about, what do you really need for pain and things like that. And, I've been clean off painkillers for 11 years now and it's amazing what just a couple of Advil will do. I've learned through really getting over my addiction that, it's okay to feel a little pain, let you're alive. And it's also amazing what just a couple Advil will do if you make your mindset that, okay, this is actually helping. I don't need to take another step.
Yeah, thank you for sharing that. We're going to dive into asking Sterling a couple questions here in just a second about kind of maybe what he's doing to combat that. So thank you so much for sharing that. So Bev, so we know that there's a relationship, right? So talk to me a little bit about maybe some of the dangers of adolescent substance use and misuse, especially as adolescent athletes.
Yeah, I have lived experience both on myself taking opioids at a recreational use. Back when Big Pharma was doing their thing of spreading them around the country, I worked for a dentist at the time that got boxes and boxes of free samples, and they would slowly disappear with me on the way home. And for whatever reason, I am one of those people that did not become addicted. I used socially and just stopped. I didn't have any withdrawal symptoms, didn't have any issues at all. That's one of the things I teach on in my classes, that you don't know how your body's going to react. And it's just one of those medical mysteries on exactly why some people become addicted very quickly and others may not. But I also have lived experience with my son, who started alcohol and marijuana probably 13, 14 years old in middle school. But he was a sports player from, t-ball on into, little league football and then high school football. And it just progressed. And the risks I'd like to talk about is just, as adolescent and teens, they already feel invincible. I think it's human nature to feel invincible, like, oh, that would never happen to me. And as a teenager, you already have that, or most, will just jump in and try anything, because their friends are doing it and they're fine, and then add on the adolescent brain is still developing, and there's just so much damage. And now that the drugs are even stronger, it's creating permanent damage, and I know too many people that have permanent psychosis from using today's marijuana in more than just leaf natural form. It's manufactured in a zillion different products now, and much, much stronger. And so, and I'm sure everyone here listening and on the panel can attest to, when you're on a substance, your risk taking, levels just increase, exponentially. You're much more likely to partake in risky behaviors. And there's studies that have done that say, students did drugs or drank alcohol before they, became sexually active, or they tried some other risky, activity. And so it just goes to show that these substances are just too risky. Outside of the game changer in this new world we live in, of fentanyl. And that is what took my 20-year-old son just about 3.5 years ago. So a lot of risks involved.
Yeah, absolutely. There are a lot of risks involved. So Sterling, talk to me about what you're doing kind of at your level to talk to patients, both before and after surgery, to help protect them when they are being prescribed pain medication.
Sure. I think it's an excellent segue. And, I will tell you that pain medication in the setting of pain after surgery, particularly, but even in any kind of acute pain scenario, things like an injury, can be a tool. And I think it's important to know that it's a tool. It's not your only tool. And so what we're trying to do is to have some, I would say, fairly novel conversations with our patients. And our patients are our mom and dad out there, anybody on the panel here, and our patients are people like Ryan. Our patients are people like the players that Courtney takes care of, right? And so we see a vast array of what's going on. And I think to that end, what's important is to have the conversation about what are your goals when it comes to getting better? What do we need to think about? What do we need to focus on? And what's the most important thing? And the most important thing is, when you are recovering from pain, are you functioning well, right? And so we talk to patients about how to judge their functional ability in a way that's concrete for them, right? I mean, if I just say to you, Courtney, how are you functioning? You're going to say fine, right? Ryan, how are you functioning? He would have said fine to me. And in the 6 years that he was playing in the NFL, he probably would have given me some story so he could get back out on the field, because that's life in that business, right? And so we do that, and we know that, and we work with that. But I think really, in addition to teaching people to think about how are you doing and how are you doing in relation to the pain that you have, question becomes, what's the best thing to do for the pain? I think Ryan touched on it earlier. It's amazing, right? I think we said it's amazing what some Advil will do. And in many cases, particularly for the type of pain that we're really talking about here when it comes to athletes, we're talking about a lot of the pain that's generated from swelling and inflammation, right? The way your nervous system is wired, you have these receptors in there. And the first thing these receptors do is they feel a little pressure and stiffness. And everybody tries to be the hero and they push through it. And if you let that pressure and stiffness build, the swelling keeps going. Eventually they have these little receptors set right back off there. This time when those things get pinged, now the message is a little bit different to your brain. The message is, hey, buddy, this hurts. And that's supposed to motivate you to action. Pain pills, opioids of any kind, they're really there to mask the intensity that your brain can perceive, right? But if we think about what does the pain feel like, very often we identify things like swelling and inflammation. And in this particular group, a young group of athletes, the likelihood that a couple of Advil is going to be a medical problem because of something else is on the smaller side than others. Not that it's negligible, right? But if and when, in the great likelihood, that's the option, it is, as Ryan said, it's amazing what some anti-inflammatories will do. And I think we try to guide people to that direction before they go down that road. I think in this particular case, because we've got a group of people gathered here, parents, coaches, athletic trainers, right? When you know our kids are recovering from pain, I think it's important to reinforce that concept to them. How are you doing? How are you doing? What are you feeling, right? And when we think about it that way, start to steer ourselves in that direction, because I know we had it alluded to in both what Bev and Ryan said, right? Who's going to get addicted it's not an exact science, but we know why it happens. The more pain pills you swallow, the more likely you are to keep stimulating that dopamine pathway. A lot of us have heard about dopamine. And when you stimulate that dopamine pathway, that's what's telling you this is something I like. I'm seeking the reward feeling that I get. Makes me feel better, right? That's one thing. Now, the other issue with the dopamine, because Bev touched on it, and I think Ryan did to some extent too, it's the idea of starting to make bad decisions, right? When the dopamine is there, it's impairing your ability to make some of those decisions. And one of the hallmarks of addiction versus dependence is that people have a need for more and more opioid, and now they're seeking the reward and making decisions they know are wrong.
That's fantastic. So share with me a little bit of some of the positive results you're seeing from having conversations with some of these surgery patients at Northwestern. You've shared with me in some of our conversations about some of the results, and I want you to share with some of our listeners today how important those conversations are and what results you're seeing from having those conversations.
Listen, they're hugely important. I mean, we've done some work, what we call quality studies, looking to see are we making some sort of a headway here, right? And one of the things we found when we first did this is that we found that the rate at which patients are requesting a refill for another round of opioid fell by about 3.5%, right? Now, you figure, in fact, I'm just working on another piece to get published, and the number we looked at is there's about 5 million prescriptions written for opioids in Illinois in 2022, right? And so if you think about reducing that by 3.5%, and if the average prescription is, say, for 20 pills, you're talking about reducing a lot of pills out there in society. And the pills are what we've talked about it, right? The pill count is what we look at. When we do pain research and opioid research, if you're ever involved in one of our studies, invariably, we're going to ask you to count your pills for us. And we're going to try and figure out how many pills did you swallow. And the reason we want to know that is we want to know how many times did you expose yourself to that concern for the dopamine stimulation, right? I know if I give you twice as much pain pill, you should get double the pain relief. But I don't know what's going to happen to your dopamine stimulation, right? And so that's why when we hear people who are recovering from addiction talk, we'll hear some people say, man, I knew I was hooked the second time I swallowed a pill. Others will say, it was 9 months and I woke up and went, whoa, I got a problem. And that's the difference in the way the dopamine pathway is stimulated. So it's really important, I think, that we all focus on how to get people to swallow fewer of these pills.
That's great. I love hearing the positive results of what you're doing, because it just re-emphasizes how important conversations are and that they really work, right? When we just start to have conversations about some of these really tough topics, it works. And I love that the work that you're doing is being reflected with data.
And, to scale it for the athletes, and Ryan and Bailey, you probably, agree with this, right? Everybody in the sports, we all working with preparation, right? Preparation. I mean, Ryan played for a guy who's legendary for his dedication and detail to preparation, right? And the idea being, if you know what's facing you, you have a better plan to find a way to success. And that's really what we're trying to do here. That's in essence a way that we're trying to see if we can really flip the script on how we treat pain.
That's great. You're talking the language of a prevention specialist. So I love to hear you talk about that. That's great. All right, David. So I'm just curious to hear from you. So I think, as we're talking about having these conversations, athletic trainers are an identified group of individuals that I think are so vital and important as, people having conversations with their athletes. They're the feet on the ground individuals, right, who are working with the injured athletes. So can you share with us in what ways athletic trainers can be a resource to individuals outside of just injury treatment?
Yeah. You guys touched on it a lot, how important conversations are to have with these athletes, right? And especially in high school. Courtney touched on it, Bev touched on it, Ryan and Stern touched on it. Like these, especially kids, but athletes in general, they undergo so much pressure, right? Sometimes they just need a way to cope. And so having these conversations with these kids is a great way for them to get stress off them. So they're not just coming to us for injury. Initially, they'll come to us for injury prevention, right? They'll sprain their ankle to come to us. But in order to gain their trust, we need to ask them, we need to see them as more than just an athlete, right? We need to see them, what's going on in your school day, right? What is going on in your family life? Like we're talking to them, we're not just treating the injury, we're treating the individual. And so having these conversations is the best way to earn that trust because they know that we care about them as a person, right? So a lot of the time, I can't tell you how many kids, a lot of their injuries, they happen because of sports, but why are they not getting better? Like they're dealing with so much stress, they can't rehab the way they want to. They're just so stressed, they're tensing up muscles. Like I can't tell you how many kids come in with neck pain and they're like, yeah, I don't know what it is, blah, blah, blah. And I'm like, okay, tell me about your day, right? And they're like, oh, I had like 3 AP tests. Like I've been studying all night and stuff. I'm like, okay, well, you're just tensing up all the time. You're just stressed. That's why your muscles are aching, sore. And, it's just having those conversations and getting to know them as people. And once they start doing that, they start trusting you. They can start talking to you about everything else. Sometimes it becomes a problem because now I have a line of people waiting to get their ankles taped and then a line of people waiting to tell me about all the other issues in their day, right? But that's the great thing about this profession, about this job, is getting to work with these kids, getting to earn their trust, right? And not just say, because I could be that guy. I could be that guy to say like, you're fine, go out and take a couple Advil, you'll be fine, go out and play, right? The athletic trainer that's trying to just get them to play the sport, right? But the most rewarding thing about this profession is the relationships and building these relationships with these kids, that they can trust you with anything, not just their physical body, but also their mental, right? And that's something that we can offer more because we're so integrated into these kids' lives and student athletes and their lives that they don't just come to us for injuries anymore. They come to us when they have questions about nutrition. When they have questions about their mental health, like how can I relax better, about sleep, right? And so we've done, my assistant athletic trainer, we've done a lot of courses on nutrition and sleep and good, healthy living habits, right? And I think a lot of the kids see that and they're starting to utilize athletic trainers. We're starting to be seen as more than just taping ankles, wrapping up boo-boos, right? We're starting to be seen as all around healthcare professionals. And I think that's something great that we have to offer in our position.
That's awesome. Thank you for sharing that. And like I said, I just know how important your role is. And I think everyone on this call does as well. So that's fantastic. And I also like that you touched on athletes being more than just an athlete. I think that's something that is really important to emphasize, especially to young athletes, that, they're not just Bailey, the soccer player, right? Like there's more to Bailey than just being a soccer player. She's here talking to us. She started a platform, a podcast, right? And so it's so important to remind them that they are more than their sport and there's so much more to who they are than what they're doing. So that's great. So Ryan, I'm curious to hear from you. How do you feel like we could help encourage athletes to ask for help, either for substance use or misuse or for mental health concerns?
Yeah, I'm glad you asked this because recently a friend of mine has been in DC, has been pushing Congress to pass something called the TEAMS Act, which would be grant funded support to schools to be able to provide more sports psychologists and different people that most smaller institutions just can't afford to have on staff. And Through that, I was in contact a lot with Berkeley, where I went, and I spoke with Ryan Cobb, who's in charge of all the sports medicine there. And he talked to me a lot about what they're actually doing now, to try to learn what the teams that could be pushing for. And through that, I learned that the best approach that they found is actually going to where the athletes are. So around campus and the training facilities, they have a lot of like nutrition stations, water, places where you can grab a quick bite and things. And at those stations, they actually have signs that they teamed up with Calm, which is like an app that helps you calm down. So it just reminds the athletes to breathe. And they also have little reminders about if they need access to mental health, go ahead and call this, remind them that it is all confidential, and there's professionals within the university and outside that could help them. So I learned that, a big part of the struggle is actually getting people to use it, because there is still a stigma to seeking out mental health support, but they found the best approach is to actually go to where the athletes are. And that there's been a big payoff. But I know most of the people we're talking to now are younger, and there's not that immediate access that I'm speaking of, but hopefully there will be soon. But just understand there is no shame in actually asking for help. Go to your athletic trainer. When I was with the Chiefs and I was spiraling out of control at the end of my career, it was my athletic trainer who noticed that I wasn't doing well. I think as an athlete, you have more contact with your athletic trainer and potentially position coach than anyone else. And because of him noticing that something was going on with me, he didn't know exactly what was going on with me. He had an idea I was taking pills because I was getting some of them from the team. But if it wasn't for him approaching me and saying, hey, I think you should talk to someone, I probably wouldn't be here today. And but you also can't wait for someone to notice that something's going on. So just don't be afraid to ask for help, because no one's going to find out.
Thank you. Reducing barriers to increase access, right? So that people aren't as apprehensive to maybe ask for help. If it's right there in front of them, or they can scan a QR code at, the water station where they're grabbing water, like the access is incredible. So that's fantastic that there are some schools who are already doing that. And I hope that can be replicated everywhere. So Bailey, who or what made you feel supported during your injury and recovery journey?
Yeah, so I think the very surface level answer that a lot of people would respond to this is my family, my friends, my teammates, support staff. But I think to get to that point and to truly feel supported, you have to believe in yourself. And Ryan, you segued it right into this for me. I had to learn, like, my injury was the first time in my life where I needed other people. I was always successful. I was always good at soccer. I didn't have to ask for help. Things just kind of worked out for me. And when my injury happened, I was vulnerable and I felt really lonely. And it was just the first time where I wasn't a star and I was in the background. So I had to learn how to ask for help, and it was embarrassing at first and it was scary. And, if I wouldn't have done that though, I don't think my family would really know how I was handling things. I think I would have felt even more left in the dark on my team. So I really had to just learn to love myself and ask for help before I could expect other people to do it for me. Like, if you don't advocate for yourself, it's hard to be mad at other people for not doing the same for you. And I kind of went down that whole hole of like, woe is me. Like, I was just mad that this was all happening to me. But the minute that I really turned my perspective and asked people for help is when I was truly being supported. And also just like finding community, like whatever you have in your life, there's a community of people who have something similar to that. So just finding other student athletes who went through injuries was really helpful for me, and support, like leaning on support from my athletic trainers were huge, and my coaches and just everyone. But it all started when I started to ask.
That's awesome. I know someone who was also really a positive influence during that time was your sports psychologist. And Dr. Albinson here is a sports psychologist. So we know how influential Bailey's athletic trainers and her sports psychologists were as she was going through her injuries and her recovery journey. What are some ways that you help student athletes with their mental wellness and health at Northwestern?
Yeah, we really take a comprehensive approach to that. So in terms of the kinds of services that we offer, that would include things like individual counseling, crisis intervention, psychiatric care, mental performance, individually and as teams. We do a lot of consultation with coaches, medical providers, other athletic staff, and also other types of outreach and education, preventative workshops, things on stress management, for example, mindfulness training. And so, when I think about supporting mental wellness, though, I think about it as more than supporting someone one-on-one who might come into our office. I know a lot of folks have already spoken to the importance of building relationships, being present, being visible. And in kind of my role as a sports psychologist, I really think it's important that we really think beyond even the direct one-on-one care we might be providing to the athlete, but really expand that view and think about including kind of the rest of the athletic system, all the different people who are in the lives of the athlete, their athletic trainer, their coaches, their parents at times, their academic advisors, their teammates. I mean, there's just so many different people that an athlete will be in contact with who are really important people in their lives. And having relationships with those folks, guiding them, consulting with them, teaching them some of the same mental wellness practices that we would encourage our athletes to practice is a way that we can care for the whole system. So I really think that that's vital, is that the approach is we can care for the athletes when we care for the whole system as well.
That's great. I often talk about, I call it the web of adults, but I often talk about this big group of adults that really work to support one individual or one adolescent. They say it takes a village, right? But it's so true. There's so many components that really all fit together to be able to successfully support an adolescent. So I think that's beautiful that you're talking about really maybe taking a step outside of that and looking at supporting that whole system rather than just the individual, because at the end of the day, that allows that individual to be a little bit more supported.
Abby, I'm listening to everybody talking about help, right? And, I told you guys earlier that we teach people to focus on functionality, and we give them 7 questions to ask. No, question number 7 is, when you're awake and recovering, are you a reasonable person to be around? Do you have good relationships with people? And I see some chuckles and some smiles, and we usually get that. And I tell people the reason it's there is because when you're in pain, when you're needing to recover, you're going to need help, right? And it is a reality of the human condition that humans help other humans who are not being jerks, right? And so if you're pushing people away, you're not going to get the help that you needed. But similarly, when you see people pushing you away, you're not going to give that help. But it's so vital and it's so important. And it tells me that question number 7 may actually be the most important question we tell people to ask.
Yeah, I love that. That's the 7th question, and maybe it should be question number 1, right? But I love that it's included in the list at least. That's fantastic. And it
maybe I'll have to rethink that, right?
Yeah, there you go. Maybe we'll put your questions in a different order for you. So
I think it's good to point out how it's almost a vicious cycle too, that you need to ask for that help, but the substances that you're hooked on are giving you that false belief that you don't need the help, that there's nothing wrong. And that's why it is important that they are asking that question, because hopefully it will be that trigger for someone to slow down and be vulnerable and look at themselves and maybe they're right, that, I can't do this on my own. So.
Yeah, it takes a village, and it takes a village to raise an adolescent, but it takes a village to support someone who's dealing with something like substance use disorder or a mental health disorder. So thank you, Bev, for sharing that. So Bailey, this kind of leads well into the question I have for you. Share with us the role that your sports psychologist and your athletic trainer and your coaches played in helping you get through your athletic injuries.
Yeah, so sometimes I think we all need a push, and that's kind of what happened to me. My athletic trainer required me to go see the sports psychologist, and that was actually the best thing that probably ever happened to me. So I saw the same sports psychologist for 3 years during my time in college, and it was just, I mean, it's a very refreshing experience to get to talk to somebody who has nothing at stake in your life other than helping you. They don't decide playing time. They don't decide how your injury is going. They don't decide how much money you're going to make. They literally are just somebody for you to talk to. And my athletic trainer and my sports psychologist both had my best interest at heart. And that was something that I really needed at that time. And one of the things that we did was just walk through worst case scenario. Like, what if this injury truly does end my soccer career? We went over it again and again and again, and it helped me heal internally. And I think that was one of the best things for me. And along with that, it was just like, if I couldn't be an advocate for myself, if I was having a bad day and I needed my athletic trainer to be like, you're not practicing today, you're only going to hurt yourself, that was someone that I could lean on to make those decisions for me, because I knew she had my best interest at heart. But I think, you know, those are two resources, and my coach is a whole different story we don't need to even go into. But just having people who support you, and, you know, you don't have to wake up and wonder if they really care about you or have your best interests. It's something that I truly need, and I think a lot of injured athletes need, because we're very vulnerable at the time, and like, we're impressionable too when we're young athletes. And just having people to support you and really, you know, be honest with you sometimes when you don't want to hear the truth, I think it's really important.
That's great. So David, you heard Bailey share how important her athletic trainers were through her journey. So share with me an example of a time that you feel like you've been able to help a student athlete, both mentally and physically.
Yeah. Thanks, Bailey, by the way, for shouting out the athletic trainers. But yeah, so actually just recently, a track athlete, a very good runner, a sprinter, dealing with a quadricep strain, right? And very distraught about it. You know, it's a strain that a lot of coaches would see, and this is that they would see it and be like, yeah, you can push through it. You can do it. And a lot of athletes feel that pressure to do it. And they're like, yep, my mind, I can push through this. It's fine. I'm invincible. I forgot who mentioned it earlier, but they're like, I'm a high school kid. I'm invincible. I can do it. And they're under that pressure that, yeah, I'm going to do it. Kept getting worse. And so recently I'm sitting down with the kid, and he's, and we go back into the conversation. I'm talking to him more about it. I thought it's just a quad strain. We're doing some rehab for it. And then it starts to turn into this downward spiral of man, my season is shot. Like, I'm not going to be able to run anymore. I'm not going to get a college scholarship for this. I'm not going to be able to, like, and I was, you know, he's just going on. And I'm just like, okay, like, I'm going to let you go, but let's slow down and say, we can fix this. We can manage this injury so that you can run again. You will be okay. But first, I think we need to kind of flip your mindset a little bit. A lot of it is very negative, and you can tell it's stemming from a lot of pressure to be this certain athlete, to reach these certain goals. I have to get this time. I have to, because this is what my peers are doing. This is what all these other people are. This is what I see, like on Instagram, my friends succeeding, and they just broke this record, and I need to do this. And I'm not going to do it anymore because of this stupid injury, and it's not going to get better. And I was like, okay, this is like day 3 of us dealing with this. So let's slow down and take it day by day, right? And so it kind of turned into just steering away from the physical aspect of what we need to do step by step to, okay, hold on, let's take it slow. Let's look at the positives, right? We stopped this before it got worse. You can run again. Let's look at all the athletes that had to undergo a significant injury, right? Who did lose something that they loved. Because let's be honest, all athletes, that's part of their identity. And then when they lose that part of them, everything kind of goes into a downward spiral, right? and they start thinking like, this is the end. I don't know what else. I don't have anything else. And so kind of getting them to flip that mindset and see like, you know what, we can make it through this. There's some other positives we can take away, right? And I've dealt with kids like this before, and at some point, and that's out of my hands. And we have the most amazing health and wellness team. We have amazing counselors on this campus that I can refer to, and that I often do refer to. But you know, I kind of see myself as like the receptionist for mental health, right? You come to me, tell me what your problems are, tell me what's issues. Okay, if we can talk through it and you feel better, great. But just so you know, we have these other resources. I think it's beneficial if you go talk to them one-on-one. And again, it takes a village, it takes a community. I'm so fortunate to have an amazing one here in the LFA. But you know, that's a lot of the stuff we deal with, especially when we see athletic injuries.
That's great. Thank you for sharing that. What a great example of just talking and reflecting how mental and physical pain are so connected, right? Thank you for sharing that. So Bev, we've talked a lot about how professionals can help adolescents and adolescent athletes specifically. What do you feel like parents can do to help support our adolescents?
Yeah, that's a loaded question, I guess. You know, I think it's the biggest thing is just don't give up. I think David was leading on to, you know, adolescents tend to think in extremes. It's never going to get better, or, you know, it's the worst, or, you know, it's always, you know, from one extreme to the next. And so us as parents need to remember that we just need to keep building them up and not breaking them down, and letting them know that it's a safe place, that you're not here to judge them. You're here to love them. And it's a tricky thing to do in that relationship of parent and child. You know, you're not there to be their best friend, but you're not there to be their drill sergeant either. You got to find that happy space, you know. And one thing I learned after the fact, you know, after I didn't know my 20-year-old son had an opioid addiction until the sheriff knocked on the door saying that he was at hospital. And so I think one of the biggest things I had to look is, how did we get here? How did me, as somebody who did drugs as a teenager, not know that this was going on in my own household? And I think we touched on it earlier, is, you know, first of all, know that the substance use disorder is non-discriminatory. It can happen to anyone, to any age, to any family. It doesn't matter what your social economic status is, what race, what sex, anything. It can touch all of us here on this panel, and we each come from different backgrounds. And it doesn't matter your education level or anything. So be open to that. Be vulnerable yourself to understand that there may be something more going on in your own family. And just push through that normal teenage, yeah, I'm fine. You know, how was your day? It was great. You know, push through and keep asking questions. And, you know, again, just making sure they understand that it's a safe place. You know, I live by the rule of being real. And, you know, the acronym in my foundation name is relational. Have that relationship with your teens. And if you haven't, tell them, I'm sorry, let's change things. We can't do anything about the past. We have to accept what we've done, and let's build for a better relationship, you know, and have that empathy that whether you understand where they're coming from, I mean, generations change, you know, each time. And so you may not understand, you know, none of us, you know, I don't know, maybe Bailey, I don't know how old you are, but, you know, grew up with the technology level that is, I mean, the generation now has never not lived without a cell phone and a computer, you know, and so we may not understand what they're going through. And so be willing to walk with them, even though you may not understand them, and be authentic. Tell them you're not perfect. Tell them that, you know, you have screwed up and you probably will again. And it's just all part of being, you know, having that loving relationship. And so the other real quickly thing I would like to mention is that remember that your own trauma is not just affecting you, and whatever's going on in your life is going on in the rest of your household as well. And that was a hard lesson for me to learn, because that is where my sons both learned that escape, you know, from what was going on at home. We had a lot of tragedies, and so we had a lot of traumas, and I thought I was handling them because they happened to me. Well, they happened to the rest of the household too. So just make sure to, you know, be open and accepting and be vulnerable, and don't stop, don't give up.
Thank you, Bev. Yeah, we know how important parents are as a part of that web of supporting our adolescent athletes. So thank you for sharing that.
Yeah, and reach out to those schools and those athletic trainers and the doctors and everybody, you know. I tried to, you know, with my kids, and sometimes I would get responses, sometimes I wouldn't. But again, I had to not give up, you know, and keep going, because parents know when something's going on. You really do. You just got to accept your gut feeling and go with it. So.
Absolutely. So Bailey, kind of jumping back to you as Bev is sharing and we're all talking, right? Obviously, adults are very vital in supporting our adolescent athletes, but we know that their peers are maybe even more important to them, right, during this time than adults are. So share with us how you feel like teammates and peers can be supportive of their own teammates and friends and peers that they're playing sports with or on other sports teams.
Yeah, well, Bev, first, I just want to say I really appreciate you sharing all your personal stories. I know it's not easy to share things so personal, so I think we all appreciate that. And you're hard to follow. So, yeah, I mean, I think one of the things I had to learn was that we all experience things differently. And if someone doesn't go through an extreme injury like I did, they probably don't understand how I'm feeling. So I had to really always remind myself that. But honestly, it's the little things. It's just being genuine. Like, there is times that I remember being at practice, sitting on the sidelines, just watching the 3-hour practice. And one of the star players would come over and just be like, hey, like, how are you doing today? And I'd say, fine. And she'd be like, no, like, how are you actually doing? I think just taking that one step farther to really find out how someone's doing, you know, and like, it takes 5 minutes, it takes 3 minutes. It doesn't take much of your day, but to me, that's something I still hold with me today. And then just like small things, like hold the door. If someone's on crutches, just hold the door and say, hey, I got you. Anything you can do to go out of your way. Like if I'm running laps at practice and I look exhausted, clap, say good job. Just like something little that reminds me that I'm still relevant and I'm still important on the team. I think it's those little things that I can still remember today that really stick out to me, and it took nothing out of somebody else's time.
Right. I love that. Yeah, asking how someone's doing, but asking it with intention, right? Not just like, how are you doing? Asking and truly wanting to know, how are you doing? I think is so important. So thank you for sharing that, Bailey. So Ryan, can you talk to us a little bit about the connection between mental pain and physical pain in regards to substance use? I know that is something that you had experienced both on, you know, on both ends, being in some sort of mental pain, but also dealing with physical pain due to injury. Talk to us a little bit about that connection through your experience.
Yeah, I mean, it sounds cliche, but I think your attitude does have or like your just mental state has a huge impact on your physical state. I think I'm living proof of that after spending 30 years closeted, and now, 10 years out, I look younger now than I did a decade ago. So, no, I definitely think that I hate cliches, but your attitude really is everything, and it goes an absolute long way. I think I'm a case study in personality changes over the years, just whether it was the drugs or just the mental state I was really doing to myself. I made all the decisions. I paid for the consequences, but I think I said earlier before this started that I'm a great example of what to do, but also what not to do, because I made about every mistake there possibly is. And someone said earlier that you just got to take a minute to take a step back and really evaluate yourself. And I never did that the whole time I was closeted and going through what I was going through with the drugs and everything else. I never paused for 10 minutes to actually shine a positive light on my situation and look at the outcomes. And also, when you have a negative mental state, I think you kind of fall into a pit of self-pity. And usually one injury leads to another injury, not necessarily because of mental problems, but I've had 6 shoulder surgeries. Once you tear it once, it's going to happen again. So you just need to find a way to mentally not let that get you down, even though realistically, your chances of re-injury are greater.
Thank you for sharing that. So Sterling, I'm curious actually to hear from you. So as Ryan is sharing, once you're injured once, the risk of being, injured again is there. So there is going to be pain, and we need to be able to manage pain. So what are some alternatives? We've talked about them kind of in the beginning of our conversation today, but share with us from your perspective as a pharmacist, what are some alternatives to pain management for athletes specifically? Because we know that pain is real, right? And athletes are going to be in some level of pain.
Oh, pain is very real. And by the way, the reason Ryan probably looks 10 years younger is because he's not having to fend off 280-pound defensive linemen making a beeline for his quarterback, right? For those of you who've never done it, that includes me. It's a brutal, brutal existence, and it takes a wear and a tear, right? I think for pain management, believe it or not, the best thing you can do is work hard toward recovery, right? That's really the best thing that you can do, and put yourself in that best position to recover. Now, very often early on in a lot of these injuries, we talked about it earlier, right? I mean, a huge driver of injury and pain from injury in athletics is the repeated trauma and the swelling and inflammation that develops from that, right? And so it is a time-tested, tried and true solution. Temperature and pressure does wonders for swelling and inflammation. Cold under some pressure is a beautiful thing. David, would you agree with that? Yeah, David's giving me the thumbs up, right? There is a distinct reason, folks, that when you watch the press conference with the pitcher after a game, or you watch the quarterback in a press conference, why that shoulder and that elbow is iced down under a bandage, right? Pressure with cold is a wonderful thing to deal with inflammation. And I think we don't ever want to forget that, right? And it comes back to, again, and I think it's bigger than just the injury and the pain. How are you doing? Bailey talked about it. How are you doing? People saying to her, how are you doing? Right? Ryan talked about it. If you have a positive mindset that you're going to make progress, you're going to achieve a goal, it's going to do wonders for helping you, and you're not going to necessarily have to treat the pain, because what's ultimately going to help you most with the pain is to recover from the injury, to strengthen. And to be in better physical condition when you can. Now, like we were joking sort of with Ryan when I started this out, right? I mean, the existence he lived professionally, I don't know that allowed you to do that, right? The constant beating, the constant, impact. But somehow there's you find a way and you look, I think, for that positive direction in how are you going to make it better.
Ryan, did you want to add something? No? Okay.
No, I'm good. I was just gonna chime in if you had something good, something else good.
Just agreeing, right? Thank you. So we're talking about this a little bit here, Dr. Courtney Albinson. We're talking about, coping mechanisms or the ability or willingness to have some of those ready to go when you're dealing with pain, and the mental side of things are so important when we're dealing with physical pain. So talk to us about some examples of coping skills or mechanisms that you share with student athletes.
Sure. So we've touched on a number of things today. So I'm going to kind of synthesize some of them because, we've talked about relationships. We've talked about mind-body connection. We've talked about mindset. So, when athletes are struggling, whether this be with injury or just simply, in terms of mental wellness, how they can build and grow and invest in their mental wellness. And that's something we all have. And that's all something that we can and really should tend to. It's kind of like how we take care of our bodies to try to prevent illness or injury. We take care of ourselves. So, some things that I would encourage athletes to do, and especially our adolescent, young adult athletes, is certainly, first of all, build your support network. Cultivate relationships. And I'd really encourage athletes to consider cultivating relationships both in and outside of their sport. Take care of your body. We haven't touched really a lot upon sleep, but oh boy, like that is something that there's so many things competing for our attention and compete with our sleep, and sleeping is very important to healing, and sleeping is very important to mental wellness. So really to prioritize sleep, ensure you're getting sufficient sleep, quality sleep, because that's going to affect your performance too. Oftentimes when athletes come in and they're coming in maybe for a performance issue, I'm going to ask them every time, tell me about your sleep. How much sleep are you getting? And I might even say, we could do all the different techniques in the world, but if you're telling me you're getting 5 or 6 hours of sleep every night, we're not going to have a lot of progress or success with what we're doing. So sleep is a very important thing for performance as well. Nutrition, taking care of your body. I mean, even when you're injured, it's really important. A lot of our dietitians are wonderful. They will work with athletes with their recovery, in terms of what they might need for fueling, but also what kinds of nutrients are really important for recovery. And helping with the swelling and the inflammation, pain, and all of those things. So I would definitely encourage proper nutrition, treating illnesses and injuries promptly, seeking that help. And in terms of some of the mindset pieces, it's really important to cultivate that growth mindset. For athletes, many times their performances on the field or the court are often connected to their identity and their self-image. And failure then can feel like a threat to that. But failure is completely a part of performance. We cannot avoid it. It's part of it. And if we embrace it as part of it and as opportunities for learning and growing and developing, we start to view our performance and our sport participation as a journey and not a one-time event. So one practice does not dictate and determine the whole entire career that you're going to have or you've had. So it's all a part of that process, and also really keeping your sport in perspective. Your sport's something that you love to do, but it's not who you are. And I really want to encourage our adolescent athletes, our young adults, to invest in other aspects of their identity and engage in activities outside of their sport. It doesn't need to be super time-consuming, significant things, but if you enjoy playing guitar or writing music, and make sure that you have some time in your week that you're doing that as well, or art, or, or whatnot. So just really to cultivate other aspects of who you are and get to know yourself as a person, beyond what you do as an athlete. And then there are certainly important things you can be doing in terms of practices that cultivate well-being, certainly that help with pain management as well, mindfulness practice. I know someone mentioned the Calm app earlier. That could be, there's apps like Calm and others that can really guide you if you're wanting some guidance and kind of doing mindfulness-based stress reduction, body scans to kind of help with the tension. Someone mentioned about kind of holding your body in a certain way. So those can be really useful tools. Deep breathing, taking a moment to pay attention to our breath and being still and present in the moment. And then I guess one other thing I'll mention, social media. We haven't gotten on that topic yet today. That is certainly kind of related to my first point around sleep. That is a real, time kind of robs us of our time. And also, we see this too with athletes who are in kind of on that big stage, higher profile. So collegiate athletes, professional athletes, Olympic athletes, there's just a lot that can go on social media, and developing a healthy relationship with it and some boundaries can be really important. That can protect your mental well-being in a lot of ways. So just, evaluating how you use social media, evaluating whether it's healthy or helpful to you, what kind of constraints, boundaries do you want to put around it? And then, certainly lastly, we've talked about this too, seeking help. Again, mental wellness is not merely the absence of mental illness. Mental wellness is something we cultivate, we grow, we develop. And we wouldn't just simply go to a doctor because only when we're sick. We also go see a doctor because we want to prevent illnesses and injuries. So, making sure that you consider reaching out for help as a part of growth and development and part of your mental wellness, versus when you're in a crisis situation and you feel like you don't have other options. So yes, we're available and we'll support in times of crisis and need, but we also want to be available as a resource in times where you feel relatively good or stable, but you're wanting to grow and learn and expand in your mental wellness and well-being.
Fantastic. Thank you for sharing that. It's so important to know our resources, not just like you said, when we're in crisis or when we need them, but using them as resources to help us prevent or to reach the goals that we're potentially wanting to get to, right? There are so many adults that are part of the web, right, who are supporting our athletes, who really truly just care about them and want them to succeed in whatever it is that they are interested in succeeding in. So thank you for sharing that. So we're going to wrap up here. I know we're a little bit over time. This has been such a great conversation. So thank you for your patience as we're going a little bit over our 8 o'clock time here. Just to wrap up, I have a question for you, Ryan. So your journey has really proven, how resilient you are. Can you share with us and our listeners here how you went from, wanting to take your own life to starting a foundation where you're now going across the country, educating adolescents and athletes? Share with us a little bit about how you kind of moved from one space to another into what you're doing now.
Yeah, it's a process. I think you're always learning and growing and figuring out who you are. But really the first couple of years after I came out, first off, it was getting clean, and the main way I was able to get sober was I fixed the underlying reason I was abusing the drugs in the first place. And I know that sounds really simple, but I think it's easier to get over an addiction if you fix the reason you're addicting. Now there's still an actual chemical dependency you need to get over, but with a doctor you can do that. But yeah, then you just got to really figure out who you are. I spent the first 30 years of my life pretending to be someone else. So you don't go from that and hating your life to knowing exactly what you like, who you are overnight. And heck, I guess I still am trying to figure out exactly what I like, which is why, I move so much and I do so many different things, but that's not a bad thing either. I every day is fabulous, but like I said, it is a process, and I really figured it out by just trying things. And, I haven't had the struggles that a lot of people I've spoken to have with painkillers after you've quit, just relapse, things like that, thankfully. But I understand from their experiences, it's a constant process for them. So yeah, I've just made a choice to be happy, not to stress. I don't stress about anything anymore. You realize how short and fragile life is, and you realize what's important. If you need help, if I need help, I reach out. There's really no shame in any of it anymore, because life really is short. So, but yeah, and after I felt like I had adequately gotten my life together, I just made a decision to try to help keep others from doing a lot of things I did, which is where writing the book and starting a charity came in. It's not easy running a charity, as I'm sure a couple of you at least on here know. It's tough. And honestly, I kind of let that take a backseat a little bit, just with everything else I've been doing with the NFL and the different programs and activities they've been trying to get together, which I actually feel is almost more beneficial, because the reach they have and the influence they have on society as a whole is much more beneficial to be kind of utilizing that resource I have. But yeah, really what I do now is just try to keep people from going down the path I did. Yeah, I was an NFL player, yeah, I went to a great college, but really all of that was just as a cover for my insecurities. And now I'm really trying to figure out what I'm doing, but I'm having a great time.
It's just incredible to hear your journey and just your experience. I just think it's so important for you to continue sharing your story. Bailey is actually someone who I've talked with obviously heavily in the past, but she has shared with me, along with many other athletes, how important it is to hear success stories from athletes who have either been injured or who have dealt with something like a substance use disorder and have seen them come through to the other side. So it's just so important, and your story is so valuable. You're making such a big impact just in so many lives across the country. So thank you for doing what you're doing and choosing to give back. It's really important. So I know we're over time here, so I just kind of want to wrap things up. If any panelists want to share just any last minute thoughts before we move into just a quick Q&A to see if anyone has any questions, feel free to unmute yourselves and share any last thoughts.
I'd just like to encourage people to continue to be vulnerable yourself, because that's the way, like Ryan was saying, is, look at why XYZ is, you're not going to be able to grow unless you kind of analyze what's going on, and where it's coming from. And, by doing that, you're going to be talking and sharing, and that's how we break the stigmas of getting help, and breaking the stigmas that go with substance use and mental illness, and just correcting some of those ignorances that society has, and just keep going, keep sharing. So thank you for everyone sharing.
At this time, if any attendees have any questions, please go ahead and throw them into the Q&A. I'll just field and see if there are any questions that we have time to answer, but I do want to give that time. So feel free to put those questions into the chat. I want to say thank you to all of our panelists for being here today, for sharing your expertise, your experiences, and your journeys. We so appreciate your time, as well as your willingness to kind of share just your experiences, both personally and professionally. We so appreciate you and your willingness to join us. I'll wait just a moment to see if any questions pop into the chat. Otherwise, I just want to say thank you to all of the attendees for joining today. And once again, thank you to all of our panelists. I do see one, just see Sterling, your chat in our chat box that says that sleep is number 6 on your list of 7 questions that you're asking patients. So that's fantastic.
Absolutely, because you're not going to get better if you don't have the energy to recover. It's very, very simple, right? If David can't put you through the exercises he needs you to get through, to heal that quad, then you're not going to heal the quad. And you're not going to heal the quad if you're not sleeping. It's a time-honored principle.
Yeah, it sure is. And it's such an important just topic to be talking about with adolescents. I mean, just with all of us, right? But adolescents specifically, as we go into high schools, that's the #1 topic that they bring up to us and talk to us about is, I'm not getting enough sleep. I'm not getting enough sleep. We have brochures on sleep, and it's the first one that comes off the table because they're aware that they're not receiving enough sleep at night. So it's so important to just keep talking about that. So it's great that it was something that came up in this conversation today. All right, it doesn't, oh, actually, I lied. As I say that, it looks like one question did come in. So for Ryan and Bailey, this question is for both of you. What is the best way that we can get more coaches on board with talking to their teams about substance use prevention?
Yeah, well, I think it starts with educating the coaches on what actually to say. You know, things like that Teams Act I was talking about would help do that. So it starts with the training. And I honestly think at least every coach I ever had at least knew something about every one of their players on a personal level. So I think there is the comfort level to talk about it, but it's never good to give the wrong advice. So hopefully there's something out there. Maybe someone on the panel knows of resources of what actually to say, but I would just say if you go into the conversation, honesty is always the best approach.
Yeah, I think just to second that, I think especially for injured athletes who may have a surgery and then get prescribed, I think it's really important to have your coach in on those conversations with the athletic trainer. I know that was something I wish my coach was a little bit more involved, just like knowing where I'm at in my process, what I'm supposed to be doing, what the plan is. I think that would also open up those conversations.
That's great. I think education is the root of prevention, right? So it's making sure that the coach feels equipped enough to have those types of conversations first before they put themselves into that situation. So it's great to hear you both mention that. Thank you for sharing that. Great. I don't see any other questions coming into the chat box. So I just want to end our session today by saying thank you once again. The recording from tonight's discussion will be sent out to all of the attendees in the next week or so to the email that you used to register for tonight's session. I encourage you to reach out to us at any time. Our email is listed here on the screen. And as Ryan mentioned, do I know any resources that can help individuals have these types of conversations? We are one of those resources. So I encourage you to visit our website, ilhep.org/prescription-playbook. Feel free to take a picture of this, or you can always just visit us on social media, and all of our website information is linked there. All of our resources are free and downloadable on our website, so I encourage you to check them out there. And we have information for adolescents themselves, parents, coaches, athletic trainers, and community members as well. So thank you all for your time today. I really appreciate it, and I hope you have a great rest of your evening. Thank you for being here.
Thanks, Abby.
Thank you all. Enjoy your evening.
Have a good evening, everyone.
Thank you.
Thank
It was
you.
great.
Your time.
Nice
Yeah.
meeting you all.